Very much. I want to say, first and foremost, I want to appreciate the President for his resolve and for his bold step to actually overhaul the health system in Kenya. As the chair of ICT at the Council of Governors, I think we have no choice but to go through this process of digitization of health services, and this is the reason. In Kenya now, if you want to go to the hospital, you will be treated, and the next time you get sick and go to another hospital, there is no record about you. There is nothing to show that you were sick at some point and what you are ailing from and what disease you are ailing from and what drugs were prescribed. So whatever we are doing in digital health is that we need to have a record of you, that we put in your patient records. It can populate anywhere in Kenya, and the doctor who is treating you can easily know what you are going through. The same thing is, it will help us to do telemedicine. We don't have enough money to actually employ, every county to employ a consultant. With telemedicine, and through this, you can be able to give a doctor in KNH or MTRH or KU National Hospital credentials, open your system, check your diagnostics, and then recommend you for treatment or a certain treatment.
And how far have you come in Elgeyo Marakwet?
In Elgeyo Marakwet, what I've done, number one is actually I've digitized my main hospital, that is the referral hospital. I'm now digitizing 7 sub-county hospitals, which is ongoing, and I want to go towards 20 model health centers and eventually roll it out to 128 facilities. Currently, we are somewhere, and of course with the CHVs, we are going to do much together, and with the gadgets that the CHVs have, we will actually ensure that we do primary health care, but digitally, and have records of all our people. So I can tell you the next level that we are doing, finally on digitization, is that it will give us trends of diseases in every area. When you digitize, I will know there is probably prevalence of certain disease in an area, so we will not be intervening generally. We will be intervening specifically and saving resources instead of just us. We will be knowing pneumonia is very rampant in this area, TB is rampant in this area, certain upsurge of a certain disease in this area. So interventions will be targeted and will actually be saving resources. So digitization is the way to go. We will also be using artificial intelligence to assess and to know what are some of the big challenges that we have as a country. And it will be showing, even in my county, it will be showing a certain small area has a certain problem. So I think it's the way to go.
And probably last question, Bwana Governor, what about the financing and the resources? Do we have that for ensuring that we digitize the whole healthcare system?
Yeah, the reason why we want it to be centralized this time is that every county, like for example myself as governor in Elgeyo Marakwet, I am doing my own small way digitization. Another county is doing their own. So what we said, why don't we have, as the chair of ICT, I was among those proponents who said, why don't we look for one platform? Just like a bank, like Equity Bank, KCB, they have one platform in Nairobi, and then all of us can be branches, and we can, not necessarily to monitor, but every one of us can utilize that system, so that eventually we are not procuring 47 systems. We have one system, cheaper to operate, it is standardized. When we are feeding into the Kenya National KDHS, health information system, we get statistics in a uniform manner. We can easily get our maybe our indicators. We can know if we are making progress or if we are going backwards. So if we have a uniform system, it becomes very easy for us. So digitization is the way to go. You can imagine if a bank is not digitized, how will you know a patient or a customer in Kericho how they are doing? So whatever we are doing it's not in Kenya. It's not only that we are starting here. It happens all over the world. These are the main countries. There are some countries which actually have digitized their medical records, and they can even know how many patients do they have in diabetes. Kenyans don't even know what they are ailing from. So this time around, we want every Kenyan to be conscious of their health, and if they are not, at least the system can remember that so and so is a diabetic patient. When the doctor sees your profile, he knows that this is a diabetic patient and is currently on this medication. Why is he not getting treatment well? Maybe I can change the medication. So the doctor will be helping you from a point of view. It can also help research which medication works, which does not work. So it's going to be very easy for doctors, for research institutions, for universities to actually do, because digitization will have a database. If you go to hospitals now, you will never get a space, because how we keep our records. Even if you were to retrieve your medical records today, it is better to go back to the CT scan, better to the lab, go back to the lab, all those. because you don't have a database which can be retrieved with a click of a button.
But now the question that many would ask is, what about digital literacy? Yes, you're talking about we are digitizing the process, and now I am probably having a show in the village. What about the education and giving them literacy?
You don't, for example, when you go to the bank, I was a banker myself. When you go to the bank, for example, Equity Bank uses Pinnacle 10, for example. No customer even knows what kind of system that Equity Bank uses. The only thing they want to know is their balances, and they go home. If they verify it's correct, they go home. Even for a show who comes for treatment, it's only fair to have our records ready, so that when she comes back to the hospital, she's not being taken in rounds to go for queues to start everything. It is not too much into the patient in terms of having information. It is for the service providers to be able to serve the patients well. So I know, of course, we still have illiteracy, but I can tell you, this thing still helps, just like an ID system, integrated personal registration system. It is there, but even me as a layman who has an ID, I don't know what happens there. But the end result and the service that I get as I'm given by the ID is much better. So we are saying it is better to have this system. It will really support us. It will help Kenyans, and it's going to be a revolution. And as the chair of ICT, I participated in this process, and I want to tell Kenyans this is the way to go, so that we can be able to have a good Kenya. We have to change this Kenya, and we have no choice. Our people have suffered for so many years. It is time they have a better life.
Asante sana, Bwana Governor. That has been Wesley Korir, the governor for Elgeyo Marakwet, who has just spoken about, he also spearheads the committee of ICT.